problems faced by the Caribbean societies require bridges between theory and praxis, especially in critical areas like medicine. People who can create those bridges are rare, and institutions dedicated to research which directly impacts the public good by producing knowledge on chronic diseases are even less common. Professor Anselm Hennis of UWI's Cave Hill is such an individual, and the Chronic Disease Research Center, which he directs and helped to build, is such an institution. The CDRC existed before Professor Hennis, but his work has transformed it.
It is fair to say that he has, in a very short time, really carried the Chronic Disease Research Center forward to such an extent that I think it is fair to say it is probably the most significant and most highly respected unit of the University of the West Indies as it relates to chronic diseases and medical research in general. One of the major developments and programs that Professor Hennis has been involved in is the development of the Barbados National Registry. This is a chronic disease registry with sub-registries of heart disease, of cancers and stroke.
Chronic diseases have been recognized to be the greatest public health challenge of the region. The benefits of such a registry are immediately evident. The activities of the CDRC encompass cancer, eye disease, and diabetes.
He also was the senior author on the 5-year mortality follow-up, quite an alarming study which showed that if you had an amputation due to diabetes, if you had a major amputation, then you had a 50% chance of dying within 1 year. And so he was also the senior author on that. That was published in 2009.
As successful as the CDRC's activities have been, the route there was not easy.
When I first returned to Barbados and I started doing research, a lot of colleagues were confused. They thought that I was eccentric, I was not focused, and the questions were like, why don't I get with the program and do something sensitive with my time? Not recognizing that research is a credible career to have, where one can make a difference by gaining information and making changes to improve the well-being of populations. That's what epidemiology is all about.
We are part of the broader Tropical Medicine Research Institute, which has a slightly overlapping set of skills, but again, that is another cluster. These kind of clusters are extremely important to do high quality medical research, because otherwise everyone is just working on their own. But I must emphasize that this is, I think, where Professor Hennis's contribution is most significant, is that he was the one who started this cluster.
In a relatively short time, from a situation in which in Barbados it was not possible and there were no opportunities for young doctors to have a career in research, we now have a situation where we can offer young physicians from the Caribbean a significant career path in research, particularly around chronic diseases.
Apart from the contributions to the academic institutions, the model of the CDRC has regional implications.
We work quite closely here with PAHO and WHO colleagues through the Ministry of Health input and Professor Hassel's input, and so PAHO have also been quite interested in taking this maybe to other countries, or talking about it with other countries, and there have been other countries involved. The National Cancer Institute in the US, which is part of the National Institutes of Health, they came over last year to meet with us to specifically talk about a NCD, or non-communicable disease registry.
In addition to his research, Professor Hennis also participates fully in other areas of his expertise as a teacher and a clinician.
I first met Dr. Hennis in 1999 as a medical student on the wards of the Queen Elizabeth Hospital. And there he made a lasting impression on me. I never forgot our first meeting. He taught me the powers of observation and asking the right questions in order to get the appropriate response.
Nonetheless, his greatest achievement is to have proven beyond doubt that the solutions to the Caribbean's problems can be found right here at home.
In order to have effective policy, one really first of all needs to know and understand the extent of the problem. And then, after that, to then determine the impact of the policies put in place. So this whole issue of measurement by Professor Hennis with the Barbados National Registry being implemented by the Chronic Disease Research Center is a major initiative and has the potential to be implemented in other Caribbean countries and therefore having an effect on policies in these countries.
For these reasons, for his work as a researcher, clinician, and teacher, for having the foresight to devote himself to gathering knowledge before its value was recognized, and for creating an institution which can deliver the region from the new plague of chronic disease, Professor Anselm Hennis has been named the Anthony N. Sabga Caribbean Awards for Excellence Laureate in Science and Technology for 2013.